Every baby cries. It's how they communicate, how they tell us they need something. But deciphering those cries, it can feel like learning a whole new language. There are nuances that can tell you if your little one is hungry, tired, or needs a diaper change. Parenting, especially in those early months, can feel a lot like that. It's high stakes, it's emotional, and you're needed in the most fundamental way. In this video, we're going to break down the different types of cries, those subtle cues that tell you exactly what your baby needs. We'll unlock the mystery together, because knowledge is power, even when it comes to baby tears. Let's start with the most primal need, hunger. A hunger cry is usually rhythmic, almost like a gentle reminder. It starts low, gradually gets more intense, and might even sound a little desperate. Recognizing those early cues is key. It's always easier to soothe a baby who's just starting to feel hungry than one who's worked themselves up into a full-blown frenzy. Responding quickly to those early hunger cues? It's a win-win. Now, have you ever felt so tired that all you could do was cry? Babies feel that too. Their sleepy cry is different. It's more of a whiny sound, sometimes nasal, almost like a little kitten. You might see them rubbing their eyes, yawning, or even trying to turn away from any kind of stimulation. They're telling you they need to recharge. A calming bedtime routine can work wonders. Sometimes it's just plain old discomfort. Think about those times you can't get comfortable. Maybe your clothes are too tight, the room is too hot, or something is just off. Babies, they cry. The discomfort cry is more erratic. It comes in bursts, starts and stops, almost like they're trying to tell you something specific. Maybe it's a wet diaper, a scratchy tag on their clothing, or the room temperature. This is where your detective skills come in. Check their diaper, feel their forehead for any signs of fever, make sure their clothing isn't twisted or too tight. Now let's talk about gas. Babies, especially in those first few months, are still figuring out their digestion. The gassy cry is hard to miss. It's often sharp, intense, and persistent, almost like a piercing shriek. You might notice your baby pulling their knees up to their chest, clenching their tiny fists, or arching their back. This is where gentle touch can make a world of difference. Try some tummy massages, bicycle legs, or even just holding your baby so their belly rests on your forearm. These simple techniques can help move those gas bubbles along and provide some much-needed relief. This is the cry that, as parents, we dread the most, the pain cry. It's sharper, louder, more intense than any other cry. It often comes on suddenly, a desperate plea for help. They can't tell you what's wrong, so they cry with everything they've got. The pain cry warrants immediate attention. Check for any obvious signs of injury, feel their forehead for fever, look for any rashes or unusual redness. Trust your instincts. If something doesn't feel right, don't hesitate to call your pediatrician. Now, not every cry is a sign of distress. Sometimes your baby just wants your attention. The attention-seeking cry starts as a low-grade fussing, a gentle reminder that they're there. This is your cue to engage. Pick them up, talk to them, sing them a song, or just let them gaze at your face. The sound of your voice, the warmth of your touch, the familiarity of your scent. These are all incredibly soothing and stimulating for your baby. On the flip side, there's such a thing as too much stimulation. The overstimulated cry is often whiny and irritated. Your baby might try to turn away from the noise or bright lights, arch their back, or even hold their hands up to their ears. It's their way of saying, "Okay, that's enough. I need a break." When this happens, it's time to retreat. Take your baby to a quiet, dimly lit room, hold them close, speak in soft, soothing tones, and let them slowly wind down. Learning to decode your baby's cries is a journey, one that takes time, patience, and a whole lot of love. Each baby is unique, and over time, you'll become an expert on yours. Trust your instincts, follow your baby's cues, and don't be afraid to ask for help when you need it. The bond you're building with your baby is one of the most profound and rewarding experiences in life. So embrace the journey, tears and all. You've got this.